I'm going to press record and say, welcome to our incredible presenters, colleagues. So often in these sessions, we have outside wonderful people joining us. Today, it is such a privilege to have two of our own joining us. So our newest autism resource specialist and board certified behavior analyst, Jacqueline McKendry, waving to you from the bottom right tile in my screen. And our incredible physician colleague, Arthi Reddy from the Division of Developmental Behavioral Pediatrics, waving to you, all lit up from her bottom left tile. And I'm gonna pass the baton to you guys, and you can share your screen, and any technical logistics we can work out along the way.
Great, so I'm gonna start off, and thank you everybody for being here. We're really excited to have this discussion with you guys today. So I am just going to share my screen, so you'll be able to see some of the slides that we've prepared. Okay. Okay, great. So I'm really excited to talk about this topic. I will say sleep is probably the most common thing that we end up discussing during so many of our visits, because it is so critical to so many different things and so many different parts of your child's life and your life. So what we hope to do today is really just to give you a brief overview of what typical sleep development should look like over time, what kinds of sleep disorders you might see or what types are out there. I'll talk very, very briefly about some of the medications that are sometimes used to help children who have significant sleep difficulties. But really the main focus of today's talk is going to be on behavioral management strategies, because that is honestly the very best way to address sleep concerns in the long term. So it's important to know that sleep doesn't always look the same. It looks really different over the lifetime. And especially the ages from birth until 5 years of age, there's a lot of different changes in what sleep can look like. And sleep is really, really important, as we all know. Not only is it important for us to feel rested and to feel refreshed during the day, but it actually has a lot of different impacts on growth and development. So certain types of hormones are secreted most at night. So all of those are actually really important and impactful for typical growth and development. And of course, as anybody who's been in a household with a child that doesn't sleep, it's really important for everybody's well-being in that household for that child to get a good night's sleep. Not only is it disruptive for the child themselves, but for the entire family sometimes. And so certainly for the mom who might be directly taking care of this very young child, or the bigger family at large, all of your well-being sometimes is very much determined by one child's sleep pattern. It actually has really important effects on your immune system as well. So even just developing certain antibodies and being able to fight off infections has been shown to be connected to good sleep as well. Another thing I didn't add here, but memory and attention skills, those are all things that are also impacted by sleep, and another good reason to promote healthy sleep habits as early as possible. So I thought it'd be a good idea to talk about the normal stages of sleep. So when I think about sleep, I often think about it as like a wave, you know, a wave that goes deeper into the ocean and then you come back up. And that's often what it's like to go through these 4 different stages of sleep. So as you know, so this is the 4 stages of sleep that you typically see in adults, and it does look a little bit different in children, and I'll talk about that a bit, but it's helpful to look at it as we hopefully are all getting sleep right now. So the 4 stages of sleep, there are 3 stages that are not in what we call REM or REM sleep. So stage 1 is just that transition period. It's when you're laying in your bed and you're waiting to go from this like really wakeful state into sleep. And that usually takes about 5 to 10 minutes, hopefully. Stage 2 is when your body starts to have some physiological changes. So your body temperature will drop, Your heart rate will slow down, your breathing will slow down. If somebody was taking an EEG and looking at your brain waves, they'd start to see these little special things that you see as you're entering sleep. And that stage lasts about 20 minutes. Now, your third stage is when all of your muscles relax, your blood pressure will start to drop, your breathing rate will drop even further, and that is when some of your deepest sleep occurs. And then REM sleep is when your brain, even though the rest of your body is relaxed, your brain is actually quite active. So your body is relaxed and it's not moving, but your brain is actually moving quite quickly. This is when you have dreams. And the reason that we call it REM sleep is rapid eye movement. It's because your eyes actually move around very rapidly underneath your eyelids during this particular stage of sleep. Now, to go through this entire cycle of sleep in an adult can take between 90 to 120 minutes, right? So 1.5 to 2 hours. And then you have a couple of those all through the night, okay? But that's gonna look different for children. So newborns, as we all know, sleep a whole lot. And I'll show you why when I show you their REM cycle in just a bit, but they sleep most of the day. They wake up to eat, they wake up to get their diaper changed, and then they go right back into it. Because they have so much growth and so much development that needs to happen during those sleep times. Now, as these children get older, their sleep hopefully starts to consolidate. So you start to see that more of their sleep is occurring during that nighttime. And by the time they hit a year of age, most one-year-olds will sleep between 10 to 12 hours a night in one stretch, with possibly 2 naps during the day. And what happens is, as I mentioned, during that wave of sleep, when you're getting deep into that sleep and then you're kind of coming back up and getting ready to go back down, those are times when you can have arousals. You can actually wake up a little bit just as you're waiting to go back down into another stage of sleep. So those are natural arousals. All of us have them between these sleep cycles. But with children, it happens more frequently, especially with younger children, because their overall cycle is shorter. It's not that 1.5 to 2 hours that you see in adults. So what's really important when these children are younger and when they're infants is to make sure that they start developing some of these techniques to self-soothe themselves, to get them to go back to sleep on their own. And that's so often as when your children are very young, is the hardest part about parenting is the sleep training. And part of this is because this is what the child needs to develop, the ability to go into that aroused state in between their sleep cycles and then be able to figure out how to soothe themselves to just go back to sleep on their own. So if they don't have that skill, that can be really tough to get these kids into a pattern where they just go back to sleep themselves without needing comfort or food or some other kind of arousal. And there are different times where things will get in the way of them being able to go back to sleep. So it's not just that they want a bottle or they want to be held, but sometimes around 6 to 18 months of age is when we see peak separation anxiety. So that's when the child just doesn't want to be away from the parent. They want to cling to them quite as much as possible. So around that age, because they are so anxious and they really want to be around you, they may not actually go back to sleep. They might actually stay awake a little bit longer. So that's a very typical developmental stage that some children will go through. Now, as I mentioned, the REM cycle or the whole sleep cycle for younger children look different. So if you look at this one for the newborn, they cycle every 45 minutes, right? So that's why they're aroused so frequently during the night, or they can wake up so easily. It's because they spend about 10 minutes starting to fall asleep, and then they get a little bit deeper for 10 to 20 minutes, really deeply asleep for 20 to 30 minutes, but then they start coming out of that. So 30 to 40 minutes, they're coming out of that heavy sleep. And then for that last hour of sleep, they're in that very light stage of sleep, and it's easy to wake up. And that's when everybody in the household is usually like, be quiet to wake up the baby. That's why. It's because they've got these stages where they can be very easily awoken, and they just happen more frequently than in adults. So This is a chart that was put out by the American Academy of Pediatrics just to give us a sense of what the normal amount or typical amount of sleep a child will need depending on their age. Now, I will warn you that this is actually highly variable. So you'll notice that these are ranges for a reason, because there is variation in how much sleep a particular child will need. So it's not that any of these numbers are hard and fast, but these are perhaps, you know, if we took a big sample of a lot of the children there, this is the range in which you will see those sleep patterns. So for infants, so for those children that are 4 to 12 months of age, typically they sleep quite a bit, anywhere from 12 to 16 hours, but that also includes their naps during the day. So it may not be all of the time they're spending at night. For toddlers who are 1 to 2 years of age, it can be 11 to 14 hours. And again, that does include naps. And you'll notice it decreases as they get older. Those preschoolers can be 10 to 13 hours, also including naps. And typically after the preschool years, children do not typically nap. So for kids who are school age, it is expected that those kids should be fully alert and awake during the day. And if they're not, then it might be an indication that they're not getting enough sleep. So kids who are 6 to 12 years of age, we typically expect that they'll get 9 to 12 hours of sleep a night. And those teenagers, anywhere from 8 to 10 hours of sleep per night. But again, there is variation on this. There's also cultural variations. There are some countries where children tend to go to bed later and wake up a bit later, or there are other areas where they go to bed later and actually still wake up at the same time. So there are variations, and there's no hard and fast rule regarding how much sleep a child needs. The best way to really know if your child is getting enough sleep is to see whether or not they're alert, they're awake. Do they feel tired during the day? Are they coming home from school and asking for a nap? That's usually a really good indication they're not getting enough sleep at night. Okay, so as I mentioned, wide range of normal for sleep durations and patterns, okay? Cultural differences, and one of the things I wanted to mention is media. So when I say media, I'm talking about pretty much any kind of screens. It's important to know what impacts that may or may not be having on your child's sleep. Now, media is something that we all use in different capacities, but in relation to sleep, screens are usually not really conducive to better sleep time routines. There are a lot of families and a lot of children that are very used to having a TV on in the background as they fall asleep. And even though that might feel like a really normal and a really good routine for you, it's actually not the best strategy in terms of long-term sleep pattern, because the light from that television actually impacts one of the hormones in your brain that helps you sleep. So we'll talk a little bit more about that in a bit. So screens are disruptive to sleep. The light exposure, as I mentioned, can suppress a hormone in your brain, which is called melatonin. And melatonin is one of the hormones that helps you fall asleep. The other thing you should be mindful of is the content of what children are watching before they go to sleep. So if they're watching something very exciting, or perhaps something violent, or perhaps something scary, all of these things can impact the quality of that child's sleep that night. So important to think about what they're being exposed to before they go to sleep. And I also find that media, it makes it really hard to actually enforce a regular bedtime routine, which I'm going to tell you is one of the bedrock of the suggestions that we have for you today. Because how many times have you heard, okay, it's time for bed, and then the child says, no, I'm not done yet. Let me just watch the end of this movie. Let me just finish this game. So that's a really, really common thing to hear. But really, in order to promote the best types of sleep routines, it has to be consistent. And I know Jacqueline's going to be talking to you about that in a little bit. So there are different kinds of sleep problems that can occur. One of the most common ones are nightmares. So we've all had nightmares. Those are those bad dreams that you still remember the next day. So those usually occur during that REM stage of sleep. They are typically early in the morning, and they typically can be remembered. So usually a child will remember that they had a nightmare. The best ways to manage those nightmares is to provide comfort whenever you need to. You can think about the content of what they might be reading, like even things like books, games, shows, whatever they're watching. All of those might have impacts on why they're having those nightmares. So those are all things to be considered. Between non-REM and REM sleep, there are a couple of different things that can happen. A really common one that I hear about is sleepwalking. So children who get up and start walking around don't have a lot of awareness necessarily of what they're doing. So that happens typically between 4 to 6 years of age, most common around 8 to 10 years of age. Usually that occurs earlier in the night. Another very, very common one that I hear about is night terrors. Night terrors can be super scary, and they actually have a really scary name, but they're actually pretty benign, which is the good news, and they do go away. So night terrors are when a child wakes up in the middle of the night, and sometimes they can be screaming, sometimes they can seem like they're in pain, but they're usually not awake, and they're usually not responsive to you when you're talking to them. Typically, we see these around 4 to 6 years of age, though you can see them across ages, and it can last just a few minutes, or can it last up to an hour. And for parents, this can be really, really scary because you think that there's something going on, your child's screaming for what appears to be no apparent reason, and then it subsides on their own. For night terrors, best thing to do is to just let them write it out, which is a hard thing to do. But you can comfort them. Do not try to wake them because they are not awake and they will not remember this in the morning. So night terrors, the difference between them and nightmares, night terrors are going to be earlier in the night and the children typically won't remember them. Nightmares are going to be earlier in the morning and they usually do remember them. The other thing I didn't put on here is something else called confusional arousals. And that's just a technical term to talk about, again, as we're going through that wave of sleep and you're waking up in between the cycles. Sometimes kids wake up a little bit confused and they won't make sense to you. You might try to have a conversation with them, but regardless, they don't actually know what's happening. They go back to sleep and they won't remember it in the morning. The less common thing that I'll mention, but really is less common, is seizures. So you can have certain types of seizures that occur in your sleep. Some of those can be characterized by things like drooling, any sort of repetitive behaviors that are happening during sleep. You might see tongue biting. If you have a child that is toilet trained, but then is having urinary accidents at night, in addition to some of these other symptoms, it could be something that you might want to mention to your pediatrician to see if it needs any further evaluation. Okay, so autism and sleep. So if you're a parent who has a child with autism and your child has sleep difficulties, you are very much not alone. 80% of children on the autism spectrum disorder also have some sort of sleep difficulty. And again, as I've mentioned, sleep is really important because it can affect their behavior during the day. It can impact their communication skills. It can impact how well they're socially interacting with other people in the household and their friends. And it could have some impact on those repetitive behaviors. Sometimes you see more of those repetitive behaviors if they're feeling frustrated and irritable. As I mentioned, sleep plays actually a very big role in memory consolidation. So we make memories as we're sleeping. We take all of those pieces of information that we've learned during the day and we smush them all together, and that's how we start to develop those memories. And because it plays such a big role in memories, it also has an impact on learning. So this is one of the first questions I'll sometimes ask if a child is having difficulties with learning, is to really hear about their sleep patterns and make sure that that's not a factor in one of their difficulties. Sleep also has a pretty significant impact on attention. So as any of us as adults know, if you don't get a good night's sleep, it's just harder to get through your day the next day. And if you're having sleep problems consistently, it can really impact your behavior and your ability to focus during the day. And it's also important because sleep problems cause a lot of stress. They can cause stress in the entire household. It can impact not only your child's behavior, but your own emotions in trying to handle this child who's having all of these struggles. So that's why a lot of our talk today is going to be to help you figure out maybe some techniques that could be helpful for you. So these are just some of the more common things that children with autism will tend to have and that I tend to hear about in my clinic. So by far the most common one is insomnia. And by insomnia, I mean falling asleep. It's really tough sometimes to fall asleep. And that is probably the most common thing that I see. And when we've looked at studies and we've looked at children who have autism and children who don't have autism, typically it takes a child with autism about 11 more minutes to fall asleep than a child who doesn't have autism. Regardless, it can take a while to fall asleep. So even for any child, it can take as much as an hour to fall asleep. And that can still be considered within the range of normal. But insomnia is probably the most common thing that we see. You can have frequent sleep disruption. So a lot of people with autism can wake up quite a few times during the night. So meaning during those arousal periods, sometimes they just wake up more frequently. And we're not totally sure why that happens. It could be because children who are on the autism spectrum sometimes are just more sensitive to certain types of sensations. So if they're more sensitive to things like noise or light or other kinds of natural sensations that happen during sleep, they might just be more sensitive to that. REM sleep latency is actually important because that's where that memory consolidation and that learning happens. And children, what some studies have shown us is that children who have autism sometimes just have shorter REM cycles. So that particular part of their sleep cycle is sometimes just a bit shorter. And then the other thing I should mention is something called sleep apnea. Sleep apnea is actually when a condition where you stop breathing when you're sleeping. Sometimes you'll notice this if your child is pausing or put what feels like a long pause in their breathing while they're sleeping, or you might notice snoring. Now, snoring is pretty typical in adults. It's not so typical in children. So if your child is snoring, it's worth mentioning to your pediatrician to ask if it's something to be concerned about. Not all snoring is concerning, but if you're having a child who's having sleep difficulties or behavioral problems, it's a good thing to think about. There are some tests that it can actually look at whether or not you have sleep apnea, and if that seems like it's appropriate, your pediatrician can guide you there. I'm going to briefly mention medication, but you see that I wrote in nice big bold letters that behavioral modifications really are the most important thing that you do for long-term improvement. So I really do want you to have a lot of information about that, and I know Jacqueline's got a lot of great information to share with you about that. But just briefly, melatonin is probably the most common thing that we will suggest if your child is having some sleep difficulties. Now, melatonin is actually the name of that hormone that I mentioned to you. So it's that hormone in your brain that helps you get ready for sleep. This is sold over the counter, so it's not something that you need a prescription for. But I would encourage you, if you are thinking about using it, have a chat with your pediatrician just so that they know that you're using it and they can give you some guidance around it. Melatonin is only helpful for the child to fall asleep. So insomnia or having that difficulty with falling asleep can be helped by melatonin. But if you're having a problem where the child is falling asleep, but then waking up repeatedly through the night, it doesn't necessarily help with that type of problem. So just recognizing that most of the medication options that we have actually only help with that first part, with the falling asleep part. Another thing that's used frequently is Benadryl. Benadryl is, of course, a medication that we typically use for allergies or allergic reactions, but the side effect of Benadryl is that it can make you sleepy. So it's not my preferred first choice, but sometimes this is effective in some children if the melatonin is not working. So I would try melatonin first before I tried Benadryl. Also keep in mind that there are some portion of children who use Benadryl don't actually get sleepy, they actually get hyperactive. So if it's helpful to know if your child is actually one of those children before you try to use it, and you only know that with trial and error. There are some other medications that require prescriptions that are sometimes used to help with falling asleep at night, but those options should be discussed with your pediatrician to see if it's the right option for your family. So now I'm going to hand off the talk to Jacqueline so she can talk to you about some of those amazing strategies.
As Jacqueline's gearing up, I'm just going to remind folks that you can put questions into the chat, and we have saved some time at the end to make sure to get to those.
Okay. Can everyone see that okay? Cool. All right, so my name is Jacqueline. I am a board certified behavior analyst and a licensed applied behavior analyst in Massachusetts. Most of my experience is running or supervising ABA programs. I have run a lot of programs in the home supporting with sleep support because a lot of my patients I find, they do have it's pretty common to have issues with sleep or around sleep. So I'm going to talk about sleep hygiene and ways to use behavioral modifications to promote like healthy sleep hygiene, healthy sleep habits, things like that. So sleep hygiene is essentially developing healthy habits or routines that occur before bedtime, and they can support having a restful sleep. So typically those activities should be enjoyed by your child, promote relaxation. So instead of like using a tablet or watching TV, something like reading a book together or playing a game or something like that where it's a little more calming before bedtime. An example of, a healthy sleep hygiene routine might be brushing your teeth, washing your face, doing a deep breathing exercise, which I'm going to go over in a little bit, reading from a book, and then going to bed. So I'll be discussing how to use those specific modifications to support a healthy sleep routine. So there is a wide variety of behavioral modification strategies out there. So I kind of came up with the best way to create an effective intervention plan when you have a child who has difficulty sleeping is first identify the problem. What is the issue around sleep? Is it falling asleep? Is it getting up in the middle of the night? What specifically is the issue around sleep? Then identifying aspects in your environment that can be modified. So I'll go into each of these. Identifying preferred items and reinforcers, identifying consequences, and then identifying how. How are we going to implement this plan? So identifying the problem, like I said, what exactly is getting in the way of your child falling asleep? These are just some examples that I've had with my own clients in the past. A child wants to co-sleep or refuses to sleep in their own bed or their own room. They might want to stay up and play or watch TV, just stay up and engage in activities that they like. Do they appear to have a lot of extra energy before going to bed? Is it rigidity around sleep behaviors? Does the sleep routine, does there have to be specific activities that occur for your child? And then also, what is it that you want to see your child doing instead? So instead of getting up in the middle of the night, do you want them to stay in their own room all night? What is the goal? For some families, it's just staying in their room throughout the night, or just staying in their bed, maybe with a book throughout the night. For others, it might just be refraining from playing with toys. But for majority, the goal is sleeping throughout the entire night. Because not only is that good for your child, it's great for the entire family so that everyone is able to get a good night's sleep. So I'm going to talk briefly about some environmental modifications. So just some things that you can do around your home to support healthy sleep routines. So these are some very simple ones, such as using this. I actually use this for myself. I use the nightlight setting on all of my electronics a few hours before I usually go to bed. It essentially it dims the light and makes it easier on the eyes. Hiding the remotes or preferred electronic activities during designated sleep times. Sometimes just turning the Wi-Fi off at night if you have a kid that likes to get up, once you go to bed and sneak onto the computer to play some games. If there's no Wi-Fi, that's not going to be possible. There's also been if you have a child who might engage in bolting or trying to leave the home at night, or even trying to get out of a specific part of the house. I have had families, we put a little bell on the door so the family is woken up when the door opens so that they can then go and support the child and bring them back to bed. So those are just some simple modifications. Some more, so creating a bedtime routine and following through with it consistently is going to be the most useful. Having a visual schedule or visual reminders in places around the house that your child will see it, like on the fridge or next to the TV or on their bedroom door, just as almost like a visual reminder throughout the day. And then it's very important to follow through with what you say. If you say TV is done at 7 o'clock, TV should be done at 7 o'clock, and begin to hide the remote, turn off the Wi-Fi, begin that process. So then as part of your intervention, you're going to want to identify reinforcers and consequences. So what exactly will they earn by following through with the desired behaviors, by staying in their bed all night or staying in their room all night, or even just sleeping throughout the night? So identifying what do they really like to play with? What are some of their favorite things, favorite toys, favorite foods, movies, that they could earn special access to for having good sleep hygiene. It might be getting ice cream for dinner or having extra time on screen time for falling asleep or staying in your room for the whole night. And then also identifying what's going to happen if your child doesn't engage in the desired sleep hygiene activities. Will they lose screen time the next day? Will they lose access to a certain toy? Or is it simply just they're not going to access a reinforcer? They're not going to get that big prize for staying in their room all night. So these are just some ways to implement an effective intervention. So a behavior contract, token boards, visual schedules. There are some apps that I also really like if you have a smartphone. So I'm going to go through each of those. So a behavior contract is just what it sounds like. I would usually use these with some of my older kiddos or young adults. So it's a contract that is written between two people, typically the parent and the child. Sometimes I'll have contracts between the parent, the child, and the teacher at school. But essentially the contract should be clear, concise, and just lay out exactly what the desired behaviors are, and what's going to happen if the child follows through, as well as what's going to happen if the child doesn't follow through. So I will earn iPad time if I stay in my room all night for 2 nights in a row. I will not earn iPad time if I do not stay in my room all night for 2 nights in a row. And it can be as simple as that. And it can be reviewed each day or each week. This is an example of a behavior. This is a better one. This is clearer, I think. A behavior contract for having a clean bedroom. And this can be modified for sleep hygiene, but essentially just 1, 2, 3, 4, 5 goals. I'll make my bed every day. I won't leave clothes on the floor, things like that. The child will sign, and then by following through, they can earn access to a preferred item or activity. So then you also have token boards, usually referred to in schools as star charts or sticker charts. So essentially, a child will earn these little tokens, and a token can be anything. I've used stars, stickers. I've used really liked, funny looking paper clips, Disney characters, things like that. So essentially, once you identify what the token, I skipped ahead, but here's an example of a token board. Here's a Sonic the Hedgehog token board where each of these little Sonic visuals is a token. So it could be every night your child stays in their room throughout the full night, they can get a token. And then once they get all of their tokens, they can trade that in for a much more preferred prize or special activity. So we need to identify how many tokens your child needs to earn before they can access the big prize. Typically, when I first start out, I want it to just be one token. If you stay in your bed all night without getting up, you're gonna get your token, and then you can access extra time on the iPad, or we can go get ice cream or something fun. It could even just be like special movie time with my family. And then systematically increasing the number of tokens that are required. So instead of getting an ice cream party for staying in my bed all night, I can only get an ice cream party when I stay in my bed for 2 nights in a row, and then make that 3 nights in a row until essentially it's about a week. And then, yeah, it could turn into monthly, if that makes sense. So here are some examples of token boards. And usually in the I'm working for, it might be I'm staying in my bed all night so that I can get extra time on the iPad tomorrow, or I'm staying in my bed all night so that we can go get a special dinner, something like that. Here's a very simple one, earning stars to work for the computer. This is typically kind of the style you'll see in the school systems. Here's a more fun one. You got cars and a road. You have to fill in all the tokens before you can access something fun. So it really can be anything, but essentially whatever token they're working for, it could be a marble jar even. I've done a token system using marbles in a marble jar. Whatever the token is, make sure your child knows exactly how to earn it, and then reinforce that. Provide them with the token, provide them with the big prize. So visual schedules, it is essentially what it sounds like, a schedule that identifies activities that can help your child engage in healthy sleep hygiene behaviors. Usually with pictures, sometimes just words, sometimes pictures and words. Here's an example of a bedtime routine visual schedule, and it's also almost like a tracking chart, so you can look back at the whole week and see how many days your child actually went to bed, stayed in bed until morning effectively. And it can also help identify, you might see patterns in like times of the week that maybe Fridays and Saturdays your child is able to stay in bed until the morning, but Mondays and Tuesdays are really difficult. So that is helpful information to know, because then you can say, okay, what is it around these Mondays and Tuesdays that my child is having such a difficult time falling asleep? And then these are just some relaxation techniques that I have used with a lot of my own clients. So the zones of regulation is a really great kind of curriculum that helps children identify their emotion and their level of arousal. And by identifying that, they can then use strategies to decrease their energy level and calm down and relax. There's also the Headspace app, which is just an app that I love. I use it for myself, and I have had a few of my own clients who really love it. You can pick a 3-minute meditation, either a video or just an audio. And it can really help just kind of relax, like calm down. There's also a variety of breathing techniques and YouTube videos online for meditation. Here's an example of the zones of regulation. So it divides emotions into 4 different sections, and it can be a really great way to not only help with sleep routine, but to also just help with self-regulation. Here's another one where this is the lazy 8 star, where you take your pointer finger, you put it on the star, you follow the arrows, you inhale, and then you exhale. And then this is another format where you have star breathing. There are a variety of different types of visuals and techniques that that your child might prefer. They might prefer the star, might prefer the lazy 8. There are a variety of different YouTube videos where you smell the rose and blow out the candles. Yeah, are there any questions? Because I do have some videos that I can pull up, but if there are any questions right now, I'm happy to.
None in Facebook chat.
Yeah, why don't you pull up some of the videos, Jacqueline, and then people can post questions. Somebody's commenting that this is very helpful, so we're glad to hear that.
Okay.
But why don't we give people some time to post some questions, and if you want to pull up any of the videos you're thinking about.
Okay. Can you see this right now or no?
No. Oh, I think you're going to have to stop your screen share and then restart it.
Okay, so this is an example of one that I used to do with a 6-year-old client, and he really loved this. He also loved fish, so it was a great match.
Breathing. With your back straight and body relaxed, let your arms hang by your side if you're standing. Or if you're sitting, rest your hands on your knees.
I'm going to skip ahead a little bit.
Follow the picture on your screen and breathe in as the arrow moves up one side of the square. Hold your breath at the top. Breathe out as the arrow moves down the other side. And hold your breath again at the bottom.
I really like the puffer fish, his expressions.
Okay, starting on one side of the square. Breathe in, 2, 3, 4. Hold, 2, 3, 4. Breathe out all the way, 3, 4. And hold your breath, 2, 3, 4. Breathe in. Keep going, sinking your breath to the arrow. Breathe out. And hold. Breathe in.
That's really it for the rest of the video. But it's a great visual support to support the breathing techniques.
Breathe in. And keep going while you follow the arrow.
I'm going to show another one. All right.
Jacqueline, we did get a question.
Okay.
This is very helpful. What hope does one have for kids around 10 who still struggle getting to sleep and then wake up at night to co-sleep? How long can it take to turn this around?
Yeah, so again, that's where you're going to want to go and look at, all right, so what is the issue? It sounds like the child is waking up in the middle of the night, going into co-sleep. Let me pull this up. So once you've identified the problem, look into any environmental modifications that you can make, but then also talk with your child about either implementing some sort of behavior contract or token board or even a visual schedule. There's also this app called Productive that I use for myself, which is awesome. It sets reminders to complete tasks, but one of them is specifically around sleep. So you can even track your own behavior, and you can see it graphed really nicely on the app. But depending on what your child likes, you know, a token board might be more efficient than a behavior contract, or a behavior contract might be more efficient than a token board. But using some sort of reinforcement system to provide reinforcement to your child for staying in their bed throughout the full night instead of getting up to sleep. So that could be something like, with a behavior contract, I will earn, depending on what your child really likes to do, I will earn extra screen time if I stay in my room all night for one night in a row. If your child is getting up every single night, I would start with just one night. Just stay in your room all night once, and then you can earn something fun, whatever it is your child really likes to do. Once they're successfully staying in their bed for, you know, 1 or 2 nights a week, then you can increase that to, okay, now you have to stay in your room for 2 whole nights before you can access extra screen time, or before we can go have a special ice cream party, something like that. So really use that reinforcement. Consequences, things like if your child doesn't stay in bed all night, it could be useful for there to be a consequence. Like, well, if you didn't stay in your bed all night, I'm sorry, you can't watch TV today. Or you can only have 5 minutes of screen time instead of the normal 30 minutes or something like that. But you also, consequences aren't necessary. I typically recommend starting just with reinforcement and providing a lot of praise, behavior-specific praise. I really love when you stay in your bed all night. I love when you are in your room from 9 o'clock at night to 8 o'clock in the morning. It makes me so happy. This is how, by doing this, this is how you're going to earn an ice cream party or extra screen time. Or you could do like a token board kind of thing, if you think that would be more useful with your child, where you're providing reinforcement for the desired behavior. And if the desired behavior, it sounds like, is your child staying in their room all night, every night. So start small. It's not going to be immediate. Your child isn't going to go from waking up every night trying to co-sleep to staying in their bed every night, every night each week. Start slow. If there is a single night that your child does stay in their room for the full night, lots of praise, lots of reinforcement, a lot of attention. I love when you stay in your bed all night, things like that. I hope that answers your question.
And I think I might just answer the other part of her question, which was, is there hope? There's always hope. Absolutely. So there's no expiration date on any of these techniques. So know that you can always go back to them if you need to, if you've been doing well for a time and then you have a regression where maybe sleep is disrupted again, you can always go back to these techniques or even try different or new ones, even if they weren't effective when the child was younger. You might find that when they're older, it might be a better time to try them. So there is always hope.
Yes. And I've actually used a behavior contract with a 19-year-old client in the past, where this particular adult was getting up in the middle of the night as soon as mom went to bed to play video games all night, and then would get to high school and fall asleep in class. So it was really affecting the school day by not sleeping at night. So we created a behavior contract, and we also turned off all the Wi-Fi at night. We hid the remotes. We hid the PlayStation consoles, we hid everything. But then we also had a big reinforcement system where we started with, if you go to bed by like 10 o'clock for one night, and I'm gonna check on you, like mom would go and check to make sure he was actually in bed and sleeping, then he could access, I think they did like a pizza party at school. And we eventually made it so that it got to, it became very natural for this adult where we eventually didn't even need the behavior contract, because it just became a habit for him to go to bed early. So you can really start any age. Even for myself, I have found that things like dimming the lights on my screens or using that night light mode on any of my electronics does have an effect on how quickly I can fall asleep. Or even like if I'm watching screen time right before I go to bed, I notice that has an effect on my own sleep. So you can, these strategies can be applied to any age.
Would you say that in dealing with sleep issues, that's a time to bring out a really, really big reinforcer? Like when you're thinking about, and you might talk a little bit more about this, Jacqueline, but like reinforcement and what makes something a reinforcer, as opposed to just a reward or just something that might be fun.
Yeah. So a reinforcer is essentially something that is going to motivate your child to continue engaging in that behavior, whatever the behavior was that was reinforced, and whatever it was that reinforced the behavior. That doesn't make sense. Basically, you want to make sure that what you're using as reinforcement or as a prize is something that your child will actually be motivated to do. And by providing choices, because one day, your child might really want to get ice cream, but the next day doesn't care about ice cream. I really want to play on my iPad. So providing choices each day for that reinforcer, you're able to identify what is going to be more preferred to your child that day, because it can change. So essentially, whatever it is that is going to motivate your child to continue engaging in that desired behavior.
Great. That's great. I think it's so important to tailor it to the child and then for them to not have access to that thing. So if that thing is extra screen time, if it's ice cream for breakfast, I'm not saying that I know this from my own household, from my own children, but let's suppose it's ice cream for breakfast, that's something that's not available any other time of day.
Yeah, definitely. You want to make sure that it's a very potent reinforcer. It's something that your child doesn't have easy access to. It might be like when I was doing early intervention and I first would start with a brand new client, 2 years old, I would come in and I would want to essentially make myself a reinforcer. So by doing this, I would have the parent hide their most preferred toys so that when I came in, the toys would all come out and then I would kind of pair myself with the most preferred toys. And we would eventually use those specific toys as reinforcers. So they would be up in the closet, but as soon as, someone made a functional request, if we're working on functional communication, then the toys would come out and it would be more of a novel item instead of just something that's in the toy box all day, every day, open access to it.
Great, thank you, Jacqueline. And we did get another question, I'm thinking more for Arthi, around melatonin. Will taking melatonin daily negatively affect my child, such as getting too used to the medication and the dose will have to keep increasing? Also, during school, I have used melatonin for my child, but disuse on the weekend. Is this preferred over giving it to my child daily?
So that's a great question. Taking melatonin daily will not negatively impact your child's sleep. So it is fine to continue taking it. You cannot get too used to the medication. So it doesn't necessarily stop working, but what does happen is that children grow and they get bigger. And any sort of medication or over-the-counter medication like this, herbal medication like this one, is distributed based on their weight. So as the child grows, it's not surprising if their dose of melatonin needs to be increased. It's just because it needs to go to more places within the body. So no, it's completely fine to continue taking melatonin. It's more about creating that routine that I wanted to emphasize. So I don't think melatonin is bad in any sort of way, but I do want to recognize that it should be done in conjunction with these very consistent bedtime routines to help you in the long run. In terms of using it during the week and not necessarily on the weekends, I think that's entirely up to you in terms of whether or not whether the melatonin is helpful for you on the weekends or not. I would argue that sleep is important regardless of whether or not it's a weekday or a weekend. So if it's important to you that your child is getting enough sleep on that weekend, then it's fine to give it on the weekend as well. If you feel like the child seems to manage fine and can go to bed a little bit later and it's also sleeping a little bit later in the morning and is still getting enough sleep, that could be fine as well. So there's no hard and fast rule on that.
Great, thank you so much. So we are up at time. This has been really incredible. You guys both, Dr. Reddy, Jacqueline, thank you so much for your time here. Thanks to the participants for your thoughtful questions, and know that we can be reached anytime at the autism program. So autism program at bmc.org. You can follow us on Facebook, Instagram. You can find information about accessing our clinic for appointments if you aren't a patient already seen by our developmental behavioral pediatric clinicians. We would love to play any role in your life. So with that, thank you everyone. Enjoy the non-100-degree weather, and we will see you next month for our next webinar.
And thank you everyone.
Thank you.